So thank you very much, gentlemen, both of you, for making the trip to Sydney, one from Adelaide, one from Melbourne, to discuss our sector where we are today. And the objective is that we're going to have a fireside chat about the sector and your respective roles and looking forward. So I didn't see you beforehand, so I'm not sure whether you saw the earlier presentations.
Yes. Yep. Yes, I saw a few of them. Had to rely on the vagaries of a Qantas flight from Bendigo, so afraid not.
Right.
So you can tell me they said whatever you want them to have said.
Well, then you're going to be in for an interesting journey, Tom, because there was discussion about the challenge that we have in terms of no aged care beds being built, no hospital beds being built. Home care workforce is... we're unlikely to be able to build too much more of a home care workforce, but we are going to have a big jump in the number of people turning 80 and then 2 years 82 and then 84 entering the system, and how are we going to accommodate it? So
does the optimism start now? Or?
Well,
Tom, it was very uplifting.
Touche.
Positivity. Yeah.
The optimism is that, firstly, we have the sector is on a better footing because we, through the work of everybody in the room, but in particular the peaks in terms of getting the co-contribution in place. So many residential aged care operators are now in a better position financially than they have in the past. More importantly, perhaps they've got certainty. So they can now be making decisions about investment and building their business in directions that they go in. Home care is a different subject, of course, because we don't know, we haven't got the full rule book yet, and yet we're only 105 days out from the 30th of June. So it was in that background, and there is optimism and all that, Tom. So I thought it would be really worthwhile to start off with. You've been in the sector now for 2 years. I think you started in September, two and a half years ago. And that was when AXA and Laser were merging. And I say to anybody when we discuss your role, most people don't appreciate you have 150 staff or thereabouts that you are the leader of. You had to go through a merger, just getting two boards together, getting their bank accounts, property, cultures, and then at the same time you had a task force. Is that a fair summation of your first 2 years?
Well, that's about 4% of it. So, 2022, September, I came in from health thinking, with respect, this would be easier than it has turned out to be. It wasn't a merger in a legal sense. It was an amalgamation of kind of two teams, but it was building a new organisation from scratch. And that's how we tried to approach it. And the sector was very clear with us. They didn't want a kind of a half-assed version of one or the other. They wanted a better version of both, plus those people who had not been a part of either. So we think of ourselves as Ageing Australia, almost a new organisation. Now, we inherited people, we inherited property, we inherited members, but what we've sought to do is establish ourselves as something distinctly different, because I think that was the only way we were going to be able to meet the expectations of the sector. They weren't just saying, merge two organisations together and then everything will be fine. They were saying, we need to do more. The Royal Commission had said the sector's viewpoint was confusing, and it was hard for the commissioners to understand what the sector thought about things because there were so many voices projecting those messages. So we do now have, it's not quite 150, maybe we're looking like we're punching above our weight. We're at 120 right at the moment, but we've got about 10 vacancies going that we're creating. We're putting about 4 more people into our policy team simply because of the quantity of just stuff that we all have to get through. Every one of those fabulous gifts from the government that will appear in your inbox that you go, oh no, that's a problem. There's weeks of work that sits behind it to even understand what it means. I'm sure there's a lot of people in this room worried about things like liquidity, pricing, guidance. Every single one of those issues takes people hundreds of hours to get across, and we just had not had the number of people necessary to do that. So we are building the team. We've got another 10 coming, probably another 10 shortly after that. just to be able to keep up with what the sector's having to deal with. And then, as you say, we had a task force, which was fantastic, by the way, the first one, the money one, because it led to a new act, which, I always say, I know the new act's not perfect, but does anybody really love the 97 Act? The 97 Act is an absolute dog of a thing, so it had to be replaced. And that task force had some of those conversations about sustainability, viability. Do we as organisations deserve to bring in more in a year than we spend in that year? Yes. Do we need a viable sector that's building? Yes. How are we going to deliver that? So that task force spent 6 months talking about those things, which we'd never been allowed to talk about before. As soon as you mentioned money in this sector a couple of years ago, everybody would do the sign of the cross and say, bad, don't talk about money, this is about older people. And the two are not mutually exclusive, and I think we've changed that narrative. So there's been a lot of water under the bridge.
It's interesting that you bring up, we've got all this work that we're doing, because the previous session with Mequacare and Cognizant explaining their 5-year journey with their tech journey, they've said to actually make change, we've got to park what we're doing and say, well, that's happening over there. We've got to create this whole new project because that's where we want to go. And the thrust of this morning's sessions were, we have this huge wave of people turning 80 that we don't have resources. So can we call it AA?
No, you most certainly cannot.
Ageing Australia.
Well done. There's a swear jar. Anyone who says AA, dollar in the swear jar, I'd already be a millionaire. Don't you start.
Well, I was going to say ACPA, but I can't say ACPA. Can't say AA, but Ageing Australia.
Yeah. Ageing Australia.
No dollar from you.
Is there a strategy, is there a plan to tackle the number of people that we can't cater for? And how are you going to execute that plan?
So I position it slightly differently. So New Zealand, across the water, they have a problem where they can't meet the needs of people now. We largely can and do, but won't be able to if we don't change the trajectory. So we're actually where, in 5 years, we'll be where they are now if we don't do something. So I actually think we have the opportunity to avoid that, but only if we start to see the doubling in the number of older people who are going to need our services over the next 20 years. So we're going to see from 1.2 million needing home care to 2.4, from 200,000 needing residential care to 400,000. Unless we start to see that as a necessary input to the plan, rather than just how do we meet the needs of the people we need to serve today, we will not get there.
But the statistics, sorry to interrupt, but the statistics say not 20 years, we're talking in 3 years. Just the sheer numbers that are coming through. We won't have beds. Even now, 81,000 for home care waiting. We don't have the beds, we don't have the workforce. Now, in 3 years, it's going to be significantly worse.
Well, so I'd say on home care, the biggest issue is people not being able to get a package, not people not being able to get a service. When we survey our members, lots of the home care providers in the country have been saying to us, we could serve more people now if more people got a package. So we couldn't serve probably everybody that we need to, but we can serve far more than we are. The 80,000 is an artificial constraint. It's the government saying we won't release enough packages to get everybody to the front of the queue. Now, if all 80,000 suddenly received their package, I suspect they wouldn't all be able to receive service immediately. But we're not as badly off as people think, because the problem is a different problem. In residential care, we are starting to see no vacancies signs go up. By the way, don't put up no vacancies signs, it looks a bit cheap. But we are starting to see the equivalent of people saying, no more beds here. And that's because nobody's building. And the idea of the task force recommendation around retentions was that it would allow people the certainty to invest in new buildings. Unfortunately, the devil is always in the detail, and whilst the Act is not necessarily the problem, the rules might be. We still don't know what higher everyday living looks like, and a lot of people's business cases are built on both a retention and higher everyday living. And so we have to resolve that. But we also have to work with the investors. There's some super funds in the exhibition room over there. Go and be talking to them about how they're going to invest their capital, because we need them to invest it with us. How are we going to get the banks, who are also here, to spend more money on us when we're still seen from a regulatory perspective as relatively high risk? So we've got a lot of hygiene issues that we've got to fix. But what you said at the beginning is important. We have more certainty than we have had probably in decades. We have at least an ability to map a trajectory. When I came into this sector, people were literally talking about not being able to pay the wages because the COVID grants hadn't been paid in 2 years. They had millions and millions of dollars of debt from the government that was not being paid. That was causing actual problems with the ability to run the company today. We don't have things like that now. And there's lots of work around the edges to make it cleaner, but ultimately the trajectory is one we can see into the future rather than one completely obscured. Not the same for home care. Home care is feeling a world of pain, and we know that. But there's things we have to do in that area as well to build the capacity of our home care. Again, talking about New Zealand, they have basically a fraction of the home care we have, and they have the problem of people going into residential care simply because there was no home care availability in their community. And their community could have been Auckland. We do not want to go there. We have to build our capacity. We also have to build, our accommodation options for people to age appropriately.
I'm interrupting you, and I apologise. I'm just conscious of the time. The conversation in the hall today has been, that's situation normal now. How do we get ahead of that? So there's been discussion around the fact by the Ian Yateses and so on of we need leadership to sort of almost park what is situation normal now and look for what can we engineer for 3 years' time that will substantially change this landscape. So, for instance, if the banks and the super funds give us the money to build these aged care homes, we're not going to see those for 7 years. And I make the regular point, we spend $100 million, takes 7 years, lots of executive time, and we only help 150 people. And you go, well, that's not moving the needle.
I'm glad we're back to optimism.
Well, it is optimism because, and the question is an optimistic question. With Ageing Australia, you're in the position to say, right, we need to put together a unit that who's separate from the day-to-day problems to go out and see how we can make everything spectacular. I think that's the word that we're looking for.
Spectacular, okay.
From the previous session.
We'll aim for spectacular. But we've got to get past the point of not having permission to innovate. At the moment, as a sector, we're still at the tail end of rebuilding trust. So the Royal Commission and COVID demolished that trust. It wasn't actually fair, but you all know it's true. We have turned around that public conversation. I used to say, as soon as I went on a TV interview or a radio interview in the early days in this job, the first thing they'd ask me is, where are the Maseratis and the kerosene baths? And they would just throw out these lazy stereotypes. They don't do that anymore. They talk to us about what is the right thing for older people in this country. They see us as a sector as the place to come to for those answers. That was the first part of it. We're not fully there, but it's much better than it was. Then we have to deliver the Act, because that's the most important recommendation of the Royal Commission. And then we can say, and you will all be relieved to hear it, goodbye Royal Commission, because it is no longer a blueprint for the future. It's delivered all of the main things that it said it was going to. We get to reclaim the design of our future sector. And so this year, post 1 July, and I know we want to get past the now, but if I tell my staff that we've got to do any more than just implementing the Act right now, I'll have a mass walkout, as most of your staff probably would as well. But post 1 July, we want to start talking about the continuum of ageing. We want to start talking about all of the services that allow older people to age in the way they wish to. Retirement living, affordable housing for older people, home care delivered into your current home or a village, and residential care as a continuum. And we want to define the plan for the future. Nobody's had the space for that for the last 5 years, but we have to retake it, because I am sick to death of having to say the Royal Commission is the blueprint for the future. It's not. It solved some problems. It made some others. But we're, 4 years past it now? Could we talk about the future, please? And that's what we want to be doing. Maybe not until July, but that's where we're optimistic.
That is hard, though. That is hard, though, given that the federal government out of nowhere puts forward liquidity ratios pointing to the Royal Commission recommendation, believing that it's done the right thing. You mentioned banks and investors early. Do you talk about an effective way to kill investment and to drive that investment away from the senior sector than by, out of the blue, putting forward a half-baked proposal that will lock up cash on your balance sheet? So the federal government's got a lot to think about in terms of policy making and the way that it does communicate and consult with the sector. Otherwise, that investment that is eager and hungry, looking at that demographic tailwind, it's going to walk away.
You've been spending a lot of time in Canberra. Retirement living is state-bound, aged care is federal. Why have you been in Canberra? If I can ask an ignorant question.
No, Chris, you showed that really flattering photo of me before from the ABC 7:30 program. I'm actually not as pale in person as I am. That's just a lens for the ABC. But the reason why we spend time in Canberra was because if we haven't been putting all that work into Canberra over the years, conversations like that one, the potential fallout of that 7:30 interview could have been catastrophic for the sector. We've seen it happen before. We're hoping that it doesn't happen again. But hence we did accept Adele Ferguson's very gracious interview to sit down with her and get interrupted 80 times in 45 minutes. But the point is, what took place after that interview was a conversation between state health ministers and the federal government, the Federal Assistant Treasurer, Stephen Jones. If our relationships weren't in a strong place before that interview, Chris, then the conversation about ASIC intervention would have absolutely come in over the top of us, because the federal government would look at us and say, we don't understand your product, we don't trust you as a sector, and we can't rely on operators to be doing the right thing. That's why we put a net promoter score in our retirement living census last year, which is plus 44. That puts us up there with your local GP, your local dentist in terms of trustworthiness. So we said to the feds, and we'll keep saying to them, stay out of our state-regulated sector. And of course, that message was delivered powerfully by state consumer affairs ministers at COAG last December, where they said, we are happy with our sector, we have regulated it appropriately. There's been so much reform over the past 5 to 7 years in particular, so much legislative reform. And I see Tammy Burkhofer nodding her head because she's been wonderful at helping us navigate our way through these reforms. At the moment, the Victorian government's reforming too, aren't they? There's some pretty crazy proposals that they've put forward. Victoria, WA, SA, New South Wales, Queensland, ACT, even Tasmania are putting through new regulations. This is a complex landscape that we're now dealing with, but we need the federal government to understand that we are trusted, we are reliable, but that we're also putting forward efficiencies, not just for consumers, but for the federal government too.
So you're a third-generation retirement village executive, grew up mowing the lawn, so to speak?
Well, I grew up sweeping out independent living units and digging trenches for plumbers, yes.
So what do you say about retirement villages being, 100,000 of them being aged care beds within 5 years?
Yeah, look, I heard that earlier. I don't entirely accept it. When we look at the numbers, there's about 210,000 ILUs around the country, providing homes for about 250,000 people. We do see that 6 in 10 new DAs for retirement villages have co-located aged care. Now, that is absolutely a pathway that our members are seeing. They are building new sites co-located with aged care next door to make sure that that option is there for them or one of the couple that moves into a retirement village, to make sure that there is that future-proofed accommodation option for them. So, no, I don't see 100,000 independent living units becoming aged care beds in the short term. We are seeing incredible innovation when it comes to the provision of care and support services. The shared care framework that we've put forward to the feds, it's now received $5 million to fund the pilot program, is a really important part of this story. Yes, people are absolutely looking for the provision of care and support services, but no, I don't think that half the ILUs around the country will become resi aged care beds.
How can you possibly say that when Tammy, there's a person in that photograph I showed, who was telling us we can't get people out of villages, and the people are going to say, I don't want to go into aged care?
Well, I think you're talking about the Victorian legislation there, are you? The proposal that...
Well, no, I'm just saying across the country, it's not, in every state when we do the village summits, the village managers say the number one question in every state is, we have residents who should not be here.
Well, that's why we are seeing operators now working with designated home care and delivery partners to bring more care in. We want to see more care per dollar invested get into villages, we aren't seeing a high incidence of retirement village operators becoming registered aged care providers. The liquidity ratio thing,
Well, they don't want
is
to.
going to keep driving them away.
Tom, everybody's getting out of aged care to get into retirement.
No, Tom, this is for you now.
Sorry, Daniel. You're both so good looking, you see.
I know it's a very diverse panel. But,
So Daniel?
Still, I have a personal rule not to be on a manel, but couldn't help it on this occasion. We are all just men, I'm sorry.
So Daniel, operators are wishing to make investments in retirement living because it hasn't got the regulations. It's more bankable. They make money out of it.
Well, it does have regulations. One of Adele Ferguson's accusations was that retirement is a loosely regulated sector, and it is anything but a loosely regulated sector. There is plenty of regulation. About every 5 years, state governments are looking to update these frameworks, and appropriately so. But our message to them is to make sure that they're not clamping things too tight that would limit the sort of innovation that we are seeing in retirement at the moment, whether you're LDK or Retire Australia, providing private aged care in retirement villages. Legislation should not be changed to clamp the innovation in the private sector, which is why our really simple message to governments all the time is get out the way, let this sector do what it does best, and that is to provide accommodation and care for older Australians.
So if I was to ask you, what is the RLC, the Retirement Living Council, doing apart from business as usual? Same question I asked Tom, Daniel. What are you doing to shape the next 5 years? This is business as normal. What do you see in 5 years' time is going to be the retirement village sector, the retirement living sector?
Well, we've launched our latest thought leadership paper in the Daily Telegraph today, actually, that focuses on two key and crucial federal reforms. Again, you ask why we spend time in Canberra. Two of those reasons are the age pension means test and, of course, Commonwealth rent assistance eligibility. Neither of those work for the retirement living sector right now. We don't see a future where we can't keep lobbying the feds. We know that when we look around the country at the moment, if you were to, for example, raise the age pension threshold from $314,000 for a single homeowner up to $550,000, in addition to getting rid of the eligibility threshold for Commonwealth rent assistance, that is, of course, if you spend less than $252,000 moving into a retirement village, $252,000, think about that, then you're eligible for CRA. We've said to the feds, if you reform age pension and of course you remove that eligibility threshold for CRA, you could unleash 59,000 homes across the country, which of course would impact about 94,000 older Australians. So these are two reforms that in a federal spending sense are quite cheap. Both of those things together will cost about $244 million a year in a prospective application. That is, in a federal sense, pocket change. But think about the impact that would have, not just on the older Australians that will get access to CRA, they'd be keeping more of their money that they've earned over the years and not have it impact their pension. But at the same time, we'll be releasing homes at the front end of the market for younger Australians. So those two key reforms, Chris, we think are crucial over the next 5 years. Now, we're not naive enough to think that the feds or the opposition will sign up to that policy today upon reading the Daily Telegraph, but it is the start of a really important conversation that will transform the way that this sector operates over the next 5 years.
So that sounds like it's business as usual for you.
Well, it's not business as usual, Chris, because the age pension is locking too many older Australians in homes that are no longer suitable for them, in addition to, of course, that really low threshold of $252,000. Now, if we have a look over the last 30 years at capital city median house growth, that's a 600% increase from 1994 to 24. The age pension allowable assets over that period have increased by 178%. This system does not work anymore. Look at the numbers. Unless we get reform to those particular areas, we're going to be seeing more older Australians locked in homes, which of course, as this room knows way too well, it leads to more trips, more slips, and of course, for some people, premature entry into aged care facilities.
Tom, to give balance, you've also been in Canberra pushing hard for a review of these pension rates and rent assistance and so on, haven't you?
So you want to talk about not the status quo. Not the status quo is all of these things being approached as the policy environment for older people rather than bits and pieces of it. And I think what we've all been guilty of is taking bites out of the problem. So whether it's the ability of older people to work longer hours before they sacrifice a proportion of their pension, or the assets tests, or residential aged care access, or rural, or whatever it is, we deal with them all as parts of the whole. And what I want to see us do is talk about a policy environment that is friendlier to ageing. So why is it that so many people need to go into either residential care younger than they should, or they need home care? It's because we've got a crap prevention system. It's because we build our communities, not our retirement communities, but our communities as a whole, to be unfriendly to ageing. So you want the future... Ooh, that was nice. You want the future... Thank you. I'll pay you after. You want the future... Actually, I agree with Daniel. Absolutely right on the specific points. We absolutely want to get rid of this nonsense liquidity thing, and we will. We will make changes to that. But it still doesn't solve the overall problem, that ageing in this country is a hard process. I got a contact from someone in the United States the other day who has a relative on the Gold Coast who has dementia, and this person in the US has to help them navigate our system. Blew their mind. I had to talk them through the process of even getting through my aged care. If we could have, they used to call it health in all policies. If we could talk about ageing in all policies, we would be talking about tax rates. We would be talking about the pension. We would be talking about prevention. We'd be talking about healthcare, and not more hospital beds, by the way. Having worked in health, most of the time people would tell you more hospital beds is the answer. It isn't. As soon as you build more hospital beds, you fill them like another lane on the freeway. It's more prevention. It's more services to communities. And then older people will be able to live and age in their community, whether in a retirement village or affordable housing or the home they grew up in, until we're able to talk about all of those things with legitimacy, instead of just, oh, wouldn't it be nice if we could change the approach to pricing care management, or wouldn't it be nice if we could fix the implications of the new liquidity rules on retirement villages? If we could talk about ageing as a whole, that would change the picture. That's what we want to do.
I think
we want to do it post 1 July so that I don't have to go off with a stress headache, but that's what we want to do.
I think we've actually circled back to the very beginning, which what you've just enunciated now is exactly the conclusion of the auditorium pre-morning tea. So it would be fair to say that Ageing Australia does have a view of where we should be going, and that we have business as normal, but we've got this vision of how the system has to change overall.
And it does have to change, but we get so stuck. And I've got a lot of members coming to me now saying, it's just so bloody hard. There's so much we have to get through. And the liquidity thing, the liquidity is bad, but it's also bad because of its timing. I mean, it came at people when they thought, okay, we've got our heads around what we need to do for 1 July. And then liquidity turns up. I mean, for F's sake, it's not my happiest week. But once we resolve that, we do think we will resolve that. We think we can get ILUs out. We think we can get the 3510 down, and the Commission hopefully still gets its same outcome. That's what we hope for. Can't guarantee it, but that's what we'd like. Then we'll move on to the next immediate challenge and the next immediate challenge. Let's get our heads above that. Let's start talking about what ageing in this country should look like, and it should look a damn sight better than it does right now.
It is hard when the government then says 1 July we're turning the switch on, despite all of this madness and none of the work that's been done and all of the problems that keep cropping up. I mean, this is disarray after dysfunction after disarray, and frankly, it's too important to get wrong, but we're just hurtling towards, as you said, Chris, 105 days' time, we're hurtling towards this political time frame that is putting immense pressure now on the retirement living sector in addition to the aged care sector.
We've run out of time, but I think in conclusion, you both are recognising that we have the system and the day-to-day fights, but we've got to engineer something better further out, and we need to start engineering that today. Would that be a fair statement?
Today is actually not soon enough, and of course that's the challenge that we see, whether it's with the Victorian government trying to impose on retirement village operators that you're now responsible for CapEx in ILUs in addition to communal facilities, or the federal government trying to reach through from a federal level into a state-regulated sector. Governments have a really important role to play. We just like them to get out the way and let this sector do what it does best and innovate.
Okay,
if I may, I think my message in the upcoming election, because it might feel like it's never coming, but it will, is job's not done. Aging's not fixed. Aged care's not fixed. It was never going to be fixed in 3 years, by the way. That was unrealistic. But there is so much more to do. But we have to remember the social license to operate. We lost it during COVID. We lost it during the Royal Commission. We have to retain it. So I don't fully agree with just get out of the way and let us do whatever we like. That's what led us to a Royal Commission. But trust us that we are the people who can implement this change, because government certainly can't. We're the ones that have to deliver the services. So trust us. Work with us, enable us, and the future will be optimistic.
And I think that's a wonderful platform. Can we show our appreciation? Thank you very much. Thank you very much.